James Machino, Associate Professor, Canadian Memorial Chiropractic College. Dr. Fred Hoy is a medical doctor, and he practices all forms of medicine. Wayne McPhail, journalist and president of... how should I pronounce this properly?
Wait and see. W8NC.
And that's of text... It's spelled in a text way, isn't it?
Yeah, that's from text messaging stuff, because my company was originally going to be focusing on text messaging.
I've never texted in my life.
It's fun.
Really?
Yeah.
No, I think it's immoral. And Paul Benedetti, lecturer, University of Western Ontario. Okay, let's come back to you on removing fillings.
Okay. If you ask any dentist, if they, after they do the filling, if there's leftover filling that's not used, they don't leave it exposed on the desk. They will learn that they have to put it in a sealed container with a liquid so that by any chance it evaporates, it will not harm the office worker or the dental worker. And then after they remove the filling, it's true.
There's no dentist here to say that isn't true.
No, it's true. And they put in a container, they have liquid, so it's sealed, and it has to be disposed by a disposable company for a fee. And then also, if you drill the drilling and you spit in the sink in the dentist chair, there has to be an electronic trap to trap it, and once a year somebody comes with a mask to remove the filling. But once it's put inside the mouth, it is safe. And it's outside the body, it is unsafe. And mercury is the most harmful thing on earth that we know.
Mercury in it? Would you be happy eating fish with a lot
So
of mercury?
generally, given that circumstances, yes, it may not suddenly kill you, but it's like spraying dust into your computer. It may not harm it, but when they cause enough pollution in your computer, it will mark your computer.
You know what I'm doing right now? I'm putting my tongue on every tooth, trying to work out how many. Anything to this?
Well, let me just go straight to it. On Dr. Hughes' site, he cites an article about this, and he quotes Dr. Hal Higgins as the guy who's the expert in this. Higgins had his license revoked in the mid-90s. In a court case, the judge said that all his treatments were sham, illusory, and without scientific basis. He also campaigned against root canals, saying that they led to disease. So I come back to my previous point. I accept that both of these gentlemen work hard for their patients, and I accept that they're well-meaning and work, try their very best to help people. Medicine and science isn't about individuals' opinions on what works and what doesn't work. I mean, can we really move forward if we just go by your clinical experience and your intuition about what might work or might not work? I think it's a crazy way to proceed.
And and the other point, to come back to a point